Intracranial tumors by Emri, Ciftci, and Siddarth Binani.
Our proposal is that we will research the history, effects, and cures for intracranial tumors.
History of intracranial tumors. In the 19th century, the first successful operation to remove an intracranial tumor was recorded as taking place in 1879. By the 1970s, the development of computed tomography scanning yields the first accurate picture of intracranial malignancies. By the 2000s, the Cancer Genome Atlas project was launched.
What are intracranial tumors? An intracranial tumor is a lump or growth of abnormal cells in your brain. An intracranial tumor's rate of growth can vary significantly. Your nervous system's ability to function depends on the growth pace and location of an intracranial tumor.
How are intracranial tumors formed? An intracranial tumor forms when abnormal cells accumulate or develop in or into the brain. There are many factors to increase the chances of getting an intracranial tumor, like age, sex, or genetics. Exposure to solvents, insecticides, oil products, rubber, or vinyl chloride may raise the chance of getting an intracranial tumor.
In this photo, you can see abnormal cells accumulating in the brain to form a tumor.
Primary versus secondary intracranial tumors.
Primary intracranial tumors originate in the brain or nearby tissues, such as the brain-covering membranes, cranial nerves, pituitary gland, or the pineal gland.
Secondary intracranial tumors. They originate away from the brain. Lung cancer, breast cancer, kidney, colon, and skin cancers are among the most common cancers that spread to your brain. Here in the picture, you can see tumor cells entering the bloodstream and spreading throughout the body. Malignant versus non-malignant tumors.
Malignant tumors are cancerous, meaning that they are harmful and uncontrollable. They may spread throughout the body, infiltrate, and destroy surrounding normal tissues. They also spread quickly. Around 30% of all intracranial tumors are malignant.
Non-malignant and benign tumors. They are non-cancerous, meaning they can't spread throughout the body. They tend to expand slowly and do not spread. 70% of all intracranial tumors are benign.
There are many types of malignant tumors, although glioblastoma is the most predominant one. There are also many variations to non-malignant tumors, where meningioma is the most predominant.
Stages of an intracranial tumor. Depending on the size and progression of the tumor, a staging method that is divided into 4 or 5 stages is typically used to determine the severity of cancer. Grade 1. The tumor is benign. The cells look nearly like normal intracranial cells. This grade is the least aggressive. As the grades go on, grades 4 or grades 5 are the most severe. Grade 4 is the malignant tissue has cells that look most abnormal and tend to grow quickly. This means that grade 4 is the most severe.
What are the symptoms of an intracranial tumor? The symptoms and signs of an intracranial tumor vary widely and are influenced by the size, location, and development rate of a tumor. Headaches, nausea, or vomiting are some of the main symptoms of intracranial tumors.
How do intracranial tumors affect people of different sexes?
Male. Men have a higher risk of developing malignant intracranial cancers. Glioblastoma is 60% more likely to develop in men. Standard therapy does not help that much. 42% of all intracranial tumors are in male.
Female. Women typically respond better to standard therapies. Standard therapy slows the development of women's tumors. 58% of all intracranial tumors are in females. How do intracranial tumors affect people of different ages?
Pediatrics. Children are at higher risk to develop tumors in the lower regions of the brain, which are areas that affect movement and coordination. Most children and adolescents who are diagnosed with an intracranial tumor will survive, and children with intracranial tumors generally have a better prognosis. 6% of all intracranial tumors occur in children. Pediatrics survive intracranial tumors 75.6% of the time.
Adult tumors are more prone to develop tumors in the upper regions of the brain, which affect memory, language, and thought. Adult tumors tend to get worse and start to develop quicker and quicker. Adults have a worse survival rate. Adults older than 40 survive intracranial tumors 72.2% of the time.
Survival and death rates of patients. After 5 years, most patients survived ependymoma and least patients survived glioblastoma.
What are the different treatment options for patients? There are 9 therapies they can choose from: immunotherapy, oncolytic virus therapy, targeted therapy, gene therapy, proton therapy, tomotherapy, radiotherapy, chemotherapy, and laser interstitial therapy. There is one more option for patients, and it is called the gamma knife.
What therapies can help cure intracranial tumors? Immunotherapy. Biological response modifier therapy, commonly known as immunotherapy, is intended to strengthen the body's inherent defenses against the tumor. Oncolytic virus therapy. This virus used in this treatment attacks and kills tumor cells while protecting normal intracranial cells. Targeted therapy. This kind of drug therapy goes after malfunctioning genes or proteins that supports the genesis and growth of tumor. Gene therapy. This kind of treatment aims to change or fix faulty genes that are promoting or causing tumor growth.
What is proton therapy? The DNA of the tumor is damaged and tumor cells are destroyed during proton beam treatment. The stream of protons is focused using a sophisticated apparatus, often a gantry that can spin 360 degrees, and a powerful magnet to create a tiny beam that is only 5 millimeters wide. The gantry then spins around the patient while the magnet steers the beam and directs it towards the tumor from a variety of angles. The DNA of the tumor is damaged by the radiation from protons, leaving it unable to heal itself or generate new cells.
What is tomotherapy? Doctors precisely define the outlines of each tumor using 3D photos and specialized software prior to initializing tomotherapy. For radiation therapy to be successful, the patient must be positioned precisely. Medical professionals can use this technology to ensure that the radiation is correctly focused from one session to the next. Proton therapy versus tomotherapy.
Proton therapy. 56% of patients were alive after 3 years. 51% of patients were alive after 5 years. 46% became cancer-free.
Tomotherapy. 54% of patients were alive after 3 years, and 48% of patients were alive after 5 years. 59% became cancer-free.
What is radiotherapy? Radiotherapy is the use of strong radiation.
What is chemotherapy? Drugs are used in chemotherapy to eradicate cancer cells. Cycles of chemo treatment are typical. After a therapy phase, there is a recovery phase and then another treatment phase, and so on.
What is laser interstitial thermal therapy? A newly developed method for treating primary and metastatic intracranial cancers that are difficult to access with traditional surgery is LITT. To execute LITT, a laser catheter must be inserted into the tumor and heated to temperatures high enough to destroy the tumor. Most patients may return to their homes the day after the treatment and immediately resume to their regular routines. Patients who suffer radiation necrosis or do not react to stereotactic radiosurgery may also benefit from LITT.
What is the gamma knife? A sort of radiation therapy called gamma knife radiosurgery is used to treat intracranial tumors, vascular malformations, and other abnormalities. As with other types of stereotactic radiosurgery, gamma knife radiosurgery does not constitute traditional surgery because there is no incision. Because of its accuracy, intracranial stereotactic radiosurgery delivers extremely little radiation to the surrounding health issues. Gamma knife radiosurgery often involves a single treatment that lasts all day.